Hello, my name is Gail DeLeiden and I'm a registered nurse in Georgetown, Texas. It's just about summer, and with summer comes a common ear ailment, very common to members of swim teams and frequent swimmers, otitis externa. I am going to present a case study to help us learn more about this condition. Jay is a 17-year-old member of the swim team, and he presented to his doctor with right ear pain that worsened at night and when he touched his ear. On examination, his ear was swollen, red, with yellow crusting. He does not have a fever, and his eardrum is intact. The physician most likely gave him a diagnosis of otitis externa, or swimmer's ear. Swimmer's ear is an infection of the external part of the ear with classic symptoms of pain, redness, drainage, itching, and possibly hearing deficit. The pathophysiology of otitis externa is a direct result of the physical structure of the ear. It is made of a very thin skin, cartilage, and bone, and because of the curve where the cartilage meets the bone, it impedes the exit of debris, secretions, and foreign objects. The skin is thin and can be traumatized easily. Also, because of the anatomy of the ear, the external canal is warm, dark, and often moist, which is a perfect environment for bacterial and fungal growth. Organisms invade the macerated skin, inflammation, and the formation of pus follows. The most common offending organisms are Pseudomonas aeruginosa and Staphylococcus aureus. Common risk factors include swimming or other water exposure. Excess moisture leads to skin macerations and the breakdown of the cerumen barrier. Trauma from excessive cleaning or aggressive scratching that removes the cerumen barrier and causes abrasions. Devices that occlude the ear canal, such as earphones, hearing aids, or diving caps. And allergic contact dermatitis from shampoos, chemicals, cosmetics, and earrings. Swimmer's ear is treated effectively with topical antibiotics in the form of eardrops. Fluoroquinolone eardrops are the first-line choice of antibiotics, but they are expensive and sometimes cost prohibitive. Polypeptide-type antimicrobials and aminoglycosides are also available. With all antibiotics, the most common side effects are nausea, vomiting, and diarrhea. Special consideration must be taken if using aminoglycosides because they can cause issues with the kidneys, which is usually reversible, or they can cause hearing loss, which is often irreversible. Steroids may be added to the eardrops to decrease inflammation and help decrease pain. Ibuprofen and acetaminophen may also be taken for pain and discomfort. It is important to keep the ear dry until the infection has cleared. Jay's doctor prescribed eardrops, which his family will be responsible for instilling. Following are instructions for how those eardrops should be instilled. First, whoever is going to instill the eardrops should wash their hands with warm soapy water. Gently wash Jay's ear with a washcloth and dry. Warm the eardrops by rolling the bottle in between the palms of the hand. Drop the medication into the dropper, and then have Jay either tilt his head to the side to expose the affected ear, or lay down on his side exposing the affected ear, and then pull the ear up and back to open up the ear canal. Place the prescribed number of drops into the ear canal, making sure that the ear canal is entirely coated. One of the most often problems with ear drop installation is that it is under dispensed. Keep the ear tilted or have the patient continue to lie on his side for 3 to 5 minutes to make sure that the medication is absorbed. A soft cotton ball can be inserted if recommended by the physician or pharmacist. Replace and tighten the cap and place in a cool, dark place out of the reach of children. Then whoever instills the drops should wash their hands again with soap and water to make sure that they remove any medication. Handouts are available that have illustrations showing the proper administration techniques. Knowledge is power, I believe, and the more information you have, the better you will be able to prevent from getting otitis externa or swimmer's ear again. For all frequent swimmers out there, it is important to shake the water out of your ears after swimming. You may also find it helpful to create a mixture of 1-to-1 vinegar and alcohol and put a couple of drops in both ears before and after swimming. Commercial preparations are also available of this mixture if you don't want to mix it yourself. There are also ear plugs that are designed specifically for frequent swimmers to help them from getting the water and moisture trapped in their ear canals. Also, there is an old saying that says, don't put anything smaller than your elbow into your ear. This is good advice. Our ears are self-cleaning, and we don't need cotton applicators or fingers inside of them to clean them. It only runs the risk of causing abrasions and also of removing the cerumen barrier that protects our ears. If you are prescribed antibiotics, make sure you take the full course of antibiotics and keep your ears dry until the infection has cleared. Thank you for listening and good luck this swim season.